So Shane is the perfect example of a young man in his mid-30s with oily skin. He has larger pores, mostly in the T-zone, but he does break out in the beard area. So we're going to give him a HydraFacial today. And a HydraFacial is essentially a non-invasive skin resurfacing treatment that we're able to, through pneumatic pressure, lift the reticular portion of the skin up into a chamber, shave off that outermost layer of dead tissue while we're stretching that connective tissue, the septa, so we're giving the skin a little workout. We're also moving lymph, which is essential for cellular health. Lymphatic fluid is full of stem cells, oxygen, proteins, and it nourishes the cells that nourish the blood and keep everything nice and healthy in that area. So by doing HydraFacials on a monthly, Shane's going to notice his pores are going to decrease in size. His oil levels are going to start to maintain a different level because if we're pushing hydration in, the body doesn't need to make as much oil. So we're going to keep that transepidermal water loss at a minimal by having well-balanced skin. So the first step in the HydraFacial is exfoliation. Through exfoliation, we're able to physically and chemically remove dead skin. So we're going to use our Active 4 solution, which is essentially lactic acid and glucosamine. We use a non-acid glucosamine, so there's nothing painful or stingy about it. We're going to start on the forehead, and I like to use the orange tip, which is the medical grade tip, and it has a lot of, it has a sharper angled base, so we can actually really scrape up that dead tissue. So Shane, how does this feel?
Feels good.
Yeah. It's very refreshing. It's a little scratchy, very similar to microdermabrasion, which I'm sure you've had before. This is called hydrodermabrasion. So instead of just scratching the skin with a diamond tip, we're actually able to shave off at a calibrated depth dead tissue, as well as introduce important topicals to the skin. Okay, so that was the first step of HydraFacial. We have another step, which is we're going to infuse glycolic acid, 7.5% glycolic acid. It's such a low percentage that it's not going to burn, but you might feel a little bit of a stingle, kind of a cross between a tingle and a sting. And this is going to do a couple things. It's going to help with bacteria. It's going to help with fibroblasts that once this hits the fibroblasts, it says make more collagen, so it's collagen building. Close your eyes, Shane. And we're just going to leave this on the skin for a couple minutes as we go into the extraction mode. So while the glycolic acid is sort of marinating on the skin, now I can go right into the extraction phase. So with extractions, I'm going to use a salicylic acid solution that is going to be going into the pore at a very high velocity. So imagine a tornado with solution in it going into the pore. And what it's doing is it's slowly dislodging that comedone so that when it's ready to come out, it does come out and the solution continues to sterilize the pore. It's so important that after you do extractions, we infuse the pores with ingredients to help combat bacteria, because that's when the pores become susceptible. So a lot of people, patients especially, will say, oh, after I get a facial, I break out. Breaking out is because you've had extractions and nothing's been put into the pores that can help retard that bacteria. And we are taking in all the toxins from the atmosphere all day long. So the only way to really clean the skin is through a vacuum-based facial. So now we have 2 different acids on the skin, best to neutralize. And these acids are self-neutralizing. They can continue to kind of stingle right in here. So now this is the last and final step. we're going to essentially infuse a very low molecular rate of hyaluronic acid, peptides, and arnica into the skin. It's a great way to decrease inflammation in the skin. So many things that we do increase inflammation in the skin. Lasers, fillers, any kind of injectable. We're constantly subjecting the skin to trauma. So you have to really make sure that the skin is in a healthy state prior to any of these sort of modalities that cause heat and trauma in the skin, because the skin's going to heal faster and better if it's in a healthy state. Well, that's it, Shane. You're all ready for your injectables now.
That was awesome.